Trudeau's health minister, Jean-Yves Duclos, telling us how it is. This is just a minute long. Take a look and listen.
But what exactly do we mean by up-to-date vaccination? Let me be very clear. Up-to-date means you've received your last dose in the past 9 months. Up-to-date means you've received your last dose in the past 9 months. If you've already received a first booster, that's great. And please see if you're eligible for a second or a third booster to remain up-to-date. But my message today, more specifically, is for those that haven't yet received their first booster. The immunity conferred by a primary series of 2 doses of vaccines administered in 2021 has now waned. While you might have gotten infected, risk is high you could get reinfected with all the downfall, including the risk of developing symptoms of long COVID. As health experts and physicians will tell you, it's critical that you go and get the shot that's waiting for you.
There's a lot in that minute, isn't there? He's now talking about a second or third booster. That's on top of what he calls 2 primary shots. So he's up to 4 now. By the way, it's the same injection every time. There's no difference. They're telling you to take up to 5 doses now. But not to stop there. You heard him. Take them perpetually every 9 months. That's the new definition of fully vaxxed. You're actually never fully vaxxed because in 9 months you'll need another. Funny, when we were kids, we got a vaccine. I remember one called MMR. I remembered it, measles, mumps, and rubella. You got it all in one shot, taken once, and then never again. You never thought about it again. There was a polio vaccine in some parts of the world. You took it once and never again. That's what a vaccine means. 5 shots of the same thing? And hang on, that's the original version of the vaccine, right? But we know the virus has evolved, right? It's mutated, it's variants. You've heard the different names of them. The Delta variant, the Omicron variant. These are different Greek letters. They're listing them. Are we still using the vaccine meant for the first variant on the what? Is it now 5th variant? Has it ever been done in science before? Is that a real thing? But the admission here was sort of buried in the bland language. These aren't vaccines at all by the standard definition. You heard him. The immunity conferred has now waned. So to use myself as an example, someone who took 1, 2, 3 doses of the jab, but 9 months has gone by, they're no better than me. In fact, maybe their natural immune system is weaker than mine. Their immunity has waned. It's actually worse than just waning. I don't know if you remember a few months ago, I showed you this incredible study out of Denmark, how after 90 days, the 2 mRNA vaccines actually reached into negative effectiveness, negative efficacy, they called it, as in they not only didn't work well, they actually worked negatively. They made you more likely to get sick than if you hadn't taken them at all. So you're no better off. You're actually more likely to get sick having taken so many jabs, says the Danish study and others. But you're also putting yourself at some risk from the vaccine itself. Now, I don't know exactly what that risk level is. I don't think we're getting all the facts, by the way. The government collects reports of vaccine injuries, but it's a voluntary system, and there is enormous pressure not to report an illness as vaccine caused. It's absurd to see headlines in the news explaining all the newfangled explanations for why young people, young healthy males in particular, keep getting heart attacks, or why Justin Bieber got his face paralyzed. Look at this one. Watching TV, gardening, an unhealthy childhood, wearing socks, and my favorite, solar storms. Yeah, that's why people are getting heart attacks now. It's my favorite one, solar storms. So yeah, you heard the man. These so-called vaccines that don't actually vaccinate you against getting the disease, whatever effect they have, and like I say, they lack their essential promise of vaccinating you, well, that effect, whatever you want to call it, wears off That's the health minister saying it himself. You say that a year ago on YouTube, you'd have your channel taken down. So none of the protection after a few months, but all the risks. In Canada, 345 deaths reported from the jab. Over 9,600 serious injuries, like heart attacks. Now stop right there. And again, these are just things that are being reported that doctors haven't written off as other things. So the total number of deaths ascribed to COVID in Canada since the beginning is 42,000. Now, I'm a skeptic of that number because anyone who dies within 30 days of a test positive for COVID was typically counted. I think I showed you that absurd case in another country. Someone fell off a ladder and died, but because they were positive for COVID, they counted it that way. So they were pumping up the numbers. In fact, a lot of the numbers are being revised down. And as you may remember, there was a miracle in 2021. Literally no one got the flu. It just didn't happen. I remember in Alberta's flu-free. Oh, really? Here's the Toronto Star. They're just amazed. And do you think there really were no flu cases last year? Or do you think, it's just possible that maybe those flu cases were called COVID cases, misdiagnosed or treated, or, for whatever reason, one respiratory disease, another respiratory disease, that some flu deaths, typically 6,000, 7,000, 8,000 people die a year from flu in Canada, that they were counted as COVID just to keep the hysteria going, keep the funding going. But Trudeau's got a problem. He needs to keep up the feeling of panic. You heard Duclos. Risk is high that you could get reinfected. It's critical that you go and get the shot that's waiting for you. Do you think that's true? Do you think people believe that anymore? Some people do. I think this is why governments love masks so much. Masks are a sign of fear, a sign that others are afraid, a sign of sickness, a sign of compliance. That's why the government loves masks. It's hard to press fear if no one looks afraid and no one is dying. And remember, the average age of death for COVID was always in the high 70s. And it was people who were typically very sick to begin with. Most people simply weren't affected by COVID, not in their real lives. The pandemic was a bust medically, but it was certainly no plague. But the government wants to wring everything they can out of it. Trudeau also has another problem. Remember this headline, I've shown it to you before. Canada has ordered more than 400 million COVID-19 vaccine shots. Here's the progress report. CBC's pretty happy. Trudeau spent billions of dollars buying 10 jabs for every man, woman, child, and baby. He'd look like an idiot if he admitted we don't need them. Look, this isn't about health. It never was. It's about power. If it was about health, we wouldn't have banned people from going to the gym or kids from going to the playground or playing sports. We wouldn't have put children in masks or kept children out of school if this was about health. We wouldn't have done the things we did if this was about health. It's about fear and control. It's about government power and your compliance. What you just saw was an excerpt from my nightly show, the Ezra Levant Show. Every weekday, I do a monologue. Usually it's about half an hour. Then I interview an interesting guest, and then we read my hate mail or my fan mail, whichever is more fun. It's only available behind a paywall, though. That's how we pay our bills here at Rebel News. We don't take a dime from Justin Trudeau. But the good news is it's only $8 a month, about half the price of Netflix. And in addition to my nightly show, you also get weekly shows from 4 other friends here at Rebel News. So you're getting 36 shows a month just for $8. I think it's worth it. And even if you're not quite sure, do it anyways, because we rely on viewers like you to keep us free and independent. I promise you I'll never take a dime from Trudeau. Just go to rebelnewsplus.com and click subscribe. Thanks.